Hey, welcome to the Go-To Physio Knee Series Part 6. Now in today's content, what I want to show you is how to make sure that the pain, the knee pain, stays away for good, okay? So how we're going to do that is when the athlete or our patient or non-sporting patient is in the gym or they're going up and down stairs or whatever it is, that they're using a good co-contraction strategy. So when that person is in the gym or they're going up and down the stairs, we want the hamstring, the calf and the glutes to all do their work. And we're going to be able to get that through using foot pressures, okay? It's a very, very important thing to be able to teach your patients to get lasting results. So with that said, let's get straight into the content today and make sure that you too get lasting changes and not just short-term quick fixes. Okay, so with the rehab and in the gym, once that athlete is relatively pain-free and they're back with the strength and conditioning coach, etc., or they're moving in the gym again, we need to make sure that they're putting good intent through the full foot. So a lot of athletes, when they go back and they go into the gym and they put weights or excessive load on the body, sometimes that can contribute towards maybe increasing the sensitivity of nociceptors, which may contribute to the pain experience. So in order to keep all the tissues happy, so to speak, and doing equal work, we can manipulate the direction of force ultimately through the foot, okay? Because the foot is the only place where we can actually have, intent to produce force with this kind of movement, okay? So what we're going to do here is, Pete, just do a split squat for me. So what I see a lot of athletes do is a lot of the weight will go through the toes, okay? So you can see here as Pete does that. So do it again, Pete, and push a bit more through the toes. The heel will almost come up, or most of the force will go through the toes. Now, as Pete goes down and pushes back up again, okay, he's going to generate a lot of torque to knee extend here, okay? So the knee extension will happen a lot earlier than the hip extension. So same again, Pete. Okay, so he's going to knee extend and then he'll obviously let the hip come through. Or the other thing I see now lately as well is almost going too far on the heel. So if you just go down through the heel, Pete, okay, stay on the heel and then back up again, okay? Keep your torso straight when you do it. That's it. And then back up again, good. Okay, so then what's going to happen is they'll use a lot of hamstring and almost distal glute, but maybe not enough gastroc or not enough quad, okay? So the ideal scenario here, okay, is we want some co-contractions happening. So Pete, what I want you to do is imagine you have an orange squashing, okay, or sorry, you have an orange under that midfoot and I want you to squash it down, okay? So you can still have a little bit of weight through the heel and toes, but I want the majority of the weight as you push back up to happen through the midfoot, okay? So as you come down, allow the weight to come down and then squash through that midfoot, good, perfect. And then back down again, and then midfoot squash, good. Now can you feel a little bit of glute, a little bit of hamstring? Yeah. And you're gonna feel a little bit of quad and a little bit of calf, okay? Same again. Down and then squash the orange to come back up again, good, perfect, and back up again, okay? So come out of that position, and then if you just come back here, and then what we can do as well is the exact same with a lunge, okay? So if that athlete's doing a lunge, a lot of them will see kind of coming through the toes or coming through the heels. But what I want to try to do is get as much intent through that midfoot as we can, okay? Because when we push through the midfoot, we're going to get both hamstring and quadricep firing, okay? We're going to get a bit of glutes and a bit of the gastroc, okay? And we want everything to work well together. We don't necessarily want to try isolate tissues because that's not really how it works in real life, okay? So when I do a lunge, Pete, I'm going to accept force, so I might go heel toe, but as I come back, I want to get as much midfoot as I can. So imagine there's that orange under the midfoot again, and I want to squash that orange to come back up again. So just give that a try for me. Good, that's it. And same again. So what that's going to do is that's going to help the gastroc, the quads, the hamstrings and the glutes. Whereas if Pete pushes off the toes, okay, so if you go again, okay, we're going to get a lot of knee extension. So you can see my knee angle here. If I push through the toes, that's what's going to happen, okay? So there's going to be very little hip extension here. My moment arm is coming from the quads, and I'm going to use the quads a lot. If I push through the heel, okay, there's not going to be a massive amount of knee extension. I'm going to get a lot of glute, a lot of lower hamstring, okay? But what I want is I want a bit of gastroc, a bit of hamstring, a bit of quad, a bit of glute. So if I push through the midfoot, Okay, I'm going to get them at the same time. So I'll keep some co-contraction at the knee, and then at the end of the hip extension, then my knee will extend. Okay, so I'm going to hip extend, and then my knee will extend as well. Okay, so the midfoot, I think it's a big part of the body that it's underutilized in rehab, but also in the gym with coaches. Okay, there's a lot of coaches these days, S&C, teaching athletes to drive through the heels. Okay, and I think that's causing some problems further down the line, where the athletes are almost using some tissues excessively and they're not using other tissues then enough. Whereas what I want is, I want everything to do their own job. I don't want to favor one or the other, because in any given moment in sport you need to be able to utilize any different muscle depending on the situation, which will be specific to the task or the goal or outcome. So that's a big thing, is watching the weight distribution in the gym with the athlete. Okay, do they have their pressure maybe too far forward on the toes? Do they have the pressure too far back on the heels? Or do we need just to give them that middle ground, push through the midfoot so that they can co-contract? And usually when you get them pushing through the midfoot in the gym, then they'll feel their hamstring, their glute, their quad, their gastroc, and everything will be stimulated. Nothing's going to be excessively stimulated, hopefully all being well. And the athlete will usually report a decreased pain experience, or they'll feel just that the movement feels lighter, more fluid and more springy. Okay, so just keep an eye out for that in the gym. Midfoot, very, very important that we get that involved in the gym, that we don't go too excessively through the heel, we don't go too excessively through the toes, okay? Because just like walking, we use heel, midfoot, toes, okay? So just like a squat or a lunge, as we come down, we're going to be putting more pressure towards the heels, and as we come up, we want that midfoot involved to help us extend, because as we walk, that midfoot has to push us through, okay, so that the calf, the gastroc, the hamstring and the quads and the glutes, they all work together to propel us forward. Okay, obviously different parts will be more active in certain angles, but that's okay. Once we have that good intent through the midfoot, the body will self-organize and it will be able to work it out. Okay, so just keep that in mind with in your gym, looking at the foot, and then we can alter the direction of force by your intent, by pushing a bit more through the midfoot rather than the toes or the heels. So there you have it. I hope you found this series useful. As I said, the intention of this series is just to help you look at the body slightly different, get confidence and clarity looking at the body as a whole, so you can differentiate yourself as that go-to therapist that can help people who have failed traditional approaches. If you found this content useful, head over to www.thegotofysio.com. I've got plenty more tips and techniques and tricks and everything there to help you become that go-to therapist. So thank you for your attention. I hope you enjoyed the 6-part series. I'll see you next time on our next series.